Are you aware that Parkinson's disease can manifest in more than just tremors? Could strange and unexpected symptoms be warning signs of something more serious? Have you noticed changes in your body that don't make sense? In this video, we'll uncover 8 unusual symptoms of Parkinson's disease that often go unnoticed. Understanding these can help you recognize early warning signs and take action before the condition progresses. By the end of this video, you'll know what to watch for, why it's essential, and how you can potentially safeguard your health or that of a loved one. Before we continue, let's understand what Parkinson's disease is. What is Parkinson's disease? Parkinson's disease is a progressive neurological disorder that affects movement. It occurs when nerve cells in a part of the brain called the substantia nigra become damaged or die, leading to a decrease in dopamine levels. Dopamine is a chemical messenger that plays a crucial role in coordinating smooth and balanced muscle movements. As Parkinson's progresses, people may experience tremors, stiffness, slow movement, and balance problems. The exact cause of Parkinson's is not fully understood, but it is believed to involve a combination of genetic and environmental factors. Just a quick reminder, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns. Now, let's dive in and explore these surprising indicators together. Number 1. Unexplained sleep disturbances and nightmares. One peculiar yet distressing symptom that individuals with Parkinson's disease often face is the occurrence of unexplained sleep disturbances accompanied by vivid, frequently unsettling nightmares. This aspect of Parkinson's can significantly impact the quality of sleep, leading to feelings of exhaustion and negatively affecting daytime functionality. The intricate nature of these sleep disturbances stems from the alterations in brain chemistry that Parkinson's induces, as well as the side effects of various medications prescribed to manage the disease's motor symptoms. These vivid nightmares and sleep interruptions are not merely standard dreams or the typical tossing and turning one might experience. Instead, they represent a profound disruption in the sleep cycle, specifically affecting the REM rapid eye movement stage of sleep, which is crucial for emotional regulation and memory. For someone with Parkinson's, the threshold between sleep and wakefulness becomes blurred, causing dreams to be acted out physically or remembered with intense clarity upon waking. The cause behind these nocturnal disturbances is linked to neurological changes in the brain due to Parkinson's. The degeneration of neural pathways and the imbalance of neurotransmitters like dopamine can significantly affect sleep patterns. It is crucial for those experiencing these symptoms to seek guidance from their physicians. Number 2. Uncontrollable urge to move legs at rest. A peculiar and often troubling symptom for many with Parkinson's disease is the experience of restless leg syndrome, RLS. This condition manifests as an overwhelming need to move one's legs when lying down or sitting, often accompanied by uncomfortable sensations such as itching, pulling, or throbbing within the limbs. These symptoms disrupt moments of rest and significantly interfere with a person's ability to fall asleep or remain asleep, contributing to the cycle of sleep disturbances common in Parkinson's disease. The link between Parkinson's and restless leg syndrome lies in the disruption of dopamine pathways within the brain. Dopamine, a neurotransmitter involved in controlling movement and coordination, becomes deficient in Parkinson's, leading to the motor symptoms and complications associated with the condition, including RLS. This deficiency plays a crucial role in developing restless leg syndrome, pointing to a shared pathophysiological basis between RLS and Parkinson's. For individuals grappling with this relentless urge to move their legs, finding relief is paramount. Treatment options often include medications that increase dopamine levels or mimic dopamine effects, directly addressing the underlying deficiency causing both Parkinson's and restless leg symptoms. However, managing this symptom extends beyond pharmacological interventions. Lifestyle adjustments and home remedies, such as maintaining a regular sleep schedule, engaging in moderate exercise during the day, and applying warm or cold compresses to the legs, can also provide significant relief. Number 3. Loss of smell and taste sensations. Among the myriad symptoms associated with Parkinson's disease, the diminution of smell and taste stands out for its direct impact on daily enjoyment and nutrition. This phenomenon, perhaps less dramatic than motor symptoms, marks a significant shift in the patient's quality of life. The impairment in olfactory and gustatory senses typically precedes the more recognizable motor symptoms as an early warning sign of the disease's onset. The underlying cause of this sensory decline is the neurodegenerative process inherent to Parkinson's, which affects the brain areas responsible for processing smells and tastes. As neurons deteriorate and the production of dopamine decreases, the ability to detect and distinguish between different odors and flavors diminishes. This sensory loss is not just a matter of faded perceptions, it can lead to decreased appetite and weight loss as food becomes less appealing without its full range of flavors and aromas. Furthermore, the impact on social interactions and emotional well-being can be profound. Meals and the act of eating are central to many social gatherings and are linked to pleasure and satisfaction. When the ability to enjoy these experiences is compromised, it can lead to feelings of isolation and depression, exacerbating the emotional challenges already posed by Parkinson's. In addressing this symptom, patients are encouraged to seek strategies that may enhance their dining experience, such as focusing on the texture and visual presentation of food, which can help compensate for the loss of smell and taste. Healthcare professionals may also recommend consulting with a nutritionist to ensure that dietary needs are met despite these sensory changes. Number 4. Difficulty swallowing and excessive drooling. The symptom complex of difficulty swallowing, known medically as dysphagia, accompanied by excessive drooling, emerges as a unique and somewhat perplexing manifestation of Parkinson's disease. This duo of symptoms significantly impacts daily living, presenting nutrition, oral hygiene, and social interaction challenges. Dysphagia in Parkinson's arises due to a disruption in the coordination of the muscles responsible for swallowing. As the disease progresses, the neurological control over these muscles diminishes, making it increasingly difficult for individuals to swallow food and liquids safely. This can lead to a higher risk of choking or aspiration, where food or liquid enters the lungs, potentially causing pneumonia. Excessive drooling, or sialorrhea on the other hand, is not due to an overproduction of saliva, but rather a decrease in swallowing frequency, allowing saliva to accumulate in the mouth. This symptom is uncomfortable and embarrassing, affecting a person's willingness to engage in social activities and impacting their overall well-being. Addressing these symptoms requires a multidisciplinary approach. Speech and language therapists are crucial in offering exercises and strategies to strengthen the muscles involved in swallowing and improve coordination. Dietary modifications, such as adjusting the texture of food and ensuring a safe eating environment, are also essential measures. Number 5. Chronic fatigue and muscle weakness. Chronic fatigue and muscle weakness stand as notable yet often underemphasized symptoms of Parkinson's disease. Unlike general tiredness, this form of fatigue doesn't resolve with rest or sleep, presenting a persistent challenge for those affected. This debilitating sense of exhaustion penetrates deep, affecting both physical capabilities and mental resilience. Individuals may find themselves struggling with tasks that once were routine, diminishing their sense of independence and impacting their quality of life. Muscle weakness in Parkinson's disease further complicates matters, as it directly correlates with the neurodegenerative nature of the condition. The progressive loss of dopamine-producing neurons in the brain disrupts normal muscle function and coordination, reducing physical strength. This weakness is not only a source of frustration, but can also contribute to an increased risk of falls and injuries, adding another layer of difficulty to daily living. Management strategies for these symptoms require a multifaceted approach. Physical therapy and tailored exercise programs can help improve muscle strength and endurance, potentially mitigating fatigue and weakness. Additionally, optimizing medication to ensure the most effective control of Parkinson's symptoms can have a beneficial impact on energy levels. Number 6. Frequent episodes of dizziness or fainting. Episodes of dizziness or fainting represent a less commonly discussed yet significant symptom encountered by many individuals with Parkinson's disease. This condition, clinically known as orthostatic hypotension, is characterized by a sudden drop in blood pressure upon standing up from a sitting or lying position. The abrupt decrease in blood flow can lead to lightheadedness, dizziness, and sometimes loss of consciousness. The correlation between Parkinson's disease and these episodes lies in the disorder's effect on the autonomic nervous system, which is responsible for regulating blood pressure. The autonomic nervous system, intricately linked with the central nervous system, undergoes degenerative changes due to Parkinson's. These changes impair its ability to adequately respond to positional changes in the body, failing to maintain stable blood pressure. This dysfunction is further complicated by the fact that certain medications used to manage Parkinson's symptoms can exacerbate blood pressure fluctuations, adding another layer of challenge to the management of these episodes. For individuals experiencing these unsettling episodes of dizziness or fainting, it is crucial to approach management with a multifaceted strategy. Simple adjustments can mitigate the symptoms, such as rising slowly from a seated position, wearing compression stockings, or increasing salt and fluid intake. However, it is paramount that these strategies are discussed and tailored to each individual by their healthcare provider, as they may not be suitable for everyone. Number 7. Reduced facial expressions. In Parkinson's disease, an unusual symptom that often goes unnoticed is a significant decrease in the expressiveness of one's face. This phenomenon, clinically referred to as hypermimia, leads individuals to present with what is commonly known as a masked face. This condition doesn't just alter one's appearance, it profoundly affects interpersonal communication and how emotions are conveyed to others. Friends and family might mistakenly interpret the individual's neutral expression as disinterest or dissatisfaction despite their internal feelings. The roots of this symptom lie in the muscular rigidity that pervades Parkinson's disease, impacting even the facial muscles. The same stiffness that hampers movement in limbs also restricts the facial muscles' flexibility and range, making expressions of joy, surprise, or concern much less pronounced. This stiffness makes voluntary facial movements, such as smiling or frowning, much more effortful and, in some cases, uncomfortable. Given the social nature of humans, the implications of hypermimia extend beyond the individual, affecting relationships and social interactions. It can lead to misunderstandings or feelings of emotional distance among loved ones, who may feel that the person with Parkinson's is unresponsive or detached. This change can be particularly disheartening for both parties involved, as expressions play a crucial role in nonverbal communication, fostering connections without words. Lastly, voice changes. Voice changes are a lesser known yet impactful symptom of Parkinson's disease, presenting as a reduced volume, a hoarse tone, or a lack of inflection that can affect an individual's ability to communicate effectively. These vocal alterations stem from Parkinson's influence on the muscles that facilitate speech, including those in the throat, diaphragm, and mouth. As these muscles become more rigid and less responsive, individuals may find their speech monotonous, softer, or easier for listeners to comprehend fully. This symptom is particularly challenging because it intersects directly with social interactions and expressing personality and emotions through speech. Conversations can become more strenuous, with the affected individual having to repeat themselves or speak more forcefully to be heard, which might only sometimes be possible due to the physical constraints imposed by the disease. Additionally, communicating can be physically tiring, discouraging social engagement, and potentially leading to isolation. In conclusion, understanding these unusual symptoms of Parkinson's disease can be crucial for early detection and better management. While tremors and stiffness are more commonly recognized, these less obvious signs, ranging from changes in handwriting to an altered sense of smell, can provide important clues. If you or someone you know is experiencing any of these symptoms, it's essential to consult your doctor for a thorough evaluation. Remember, awareness is the first step toward effective care. Thanks for watching, and don't forget to like, subscribe, and hit the notification bell for more health insights.